at the U of O. Dr. Ray,
Hello.
are you running out of patience with the anti-vaxxers too?
Well, gauging from my inbox, which is always filled with all sorts of flavors of hate mail. Yeah, I'm losing patience.
What
But
do they hate? What do they hate about you?
oh, they hate my hair.
Well, you got off easy.
No, they hate my position on vaccination and think I'm a paid shill for big pharma, whatever it might be. I am, and I'm not losing patience. I'm losing patience with the overall effort, but individuals, I do have some time for individuals. I like to think about the vaccine resistant as a heterogeneous group. There are the hardcore anti-vaxxers who are quite in your face, and to me, they're a religious movement. I don't have a lot of time for religious movements. There are those who are hesitant because they're just nervous about this new product. For them, I got all the time in the world. There
Absolutely.
are those who are apathetic, who just need a kick in the pants to get vaccinated. For them, I'm happy to give them that kick in the pants. And then there are those I really worry about. People who want the vaccine but don't have opportunity because they need childcare, they need a day off work, they need a vehicle. We should be doing everything we can to get that group access to vaccines as quickly as possible.
Is that group not getting smaller? I mean, this should have
It
been
is.
an issue from day one. I don't know how many times you and I have talked about this group.
Yeah, they are getting smaller, but they still exist. And there are, of course, all these things are confounded by immigration status, racialized populations,
That's true.
deeply seated cultural issues around distrust for public health. We got a lot of work to do.
Okay, let's talk if we can. Back to school is just around the corner. Are you? I can't remember. Are you? I've talked with so many doctors over the last couple of days. Are you in favor of mandatory vaccinations for teachers and staff at schools?
Yes, 100% I am.
How do you feel about this issue? It came up yesterday because kids under the age of 12, of course, can't get vaccines yet. That could change in the next couple of months, but in the meantime, they're going back to class unvaccinated. The concern that we're seeing down in the United States, and this is how the conversation started, is that the kids who are getting sick and ending up in the hospital with COVID aren't getting it at school. Dr. Ray, they're getting it from their unvaccinated parents. Knowing that information, that's the source of the majority of the problem in kids, shouldn't we demand that parents be double vaccinated and prove it before they can send their kids back to class?
Ooh, that's a tough one. That's a civil liberties question rather. And I'm comfortable with that. I'm more comfortable with compelling professions to get vaccinated because no one is entitled to a profession. Whereas these are just people going about their lives. I don't like the idea of compelling people to accept something into their veins that they don't
So,
want.
so, so you're going to put my kids at risk because others have decided not to do it. Is how I push back.
Yeah, I mean, like I have no obvious good answer here.
Yeah.
My reflex is, of course, I want all the people, adults that my kid is going to come in contact with secondhand to be vaccinated. But I understand the civil liberties argument and the long push we have to greater acceptance via the hearts and minds process and compelling parents to accept vaccination may drive them into a corner prematurely to make our jobs harder in the long run.
Yeah, I mean, look, your job's going to be a lot harder, and your colleagues much more than mine when things go further south. God forbid. That being said, vaccinations work. We see that. We're seeing, although we got 650 in the province today, so the numbers are creeping up. Hospitalizations aren't accordingly, which is good news. And the takeaway here is that the unvaccinated are the ones who are ending up. I can't say this enough because I'm trying to convince them. Are the ones who are ending up in hospital.
Oh yeah, look in Ottawa, the risk to the unvaccinated is 20 times higher than to the vaccinated for it being infected. On the province as a whole, the unvaccinated have a 20 times higher risk of being hospitalized and a 70-time higher risk of being in the ICU. Undoubtedly, the pandemic right now is a pandemic of young unvaccinated people. Now, the flip side of that is young unvaccinated people are less likely to be hospitalized and die, but they're not invulnerable because so many of them will be hospitalized and many will die, as we are seeing in places like Florida, Louisiana, and Texas.
In some ways, we just thought that the majority of us would do, and we have, but the numbers would be strong enough to put us into herd immunity that we wouldn't even have to have this discussion. I think that's how it all rolled out. We're good Canadians. We care about each other. We're going to roll up our sleeves, and now we find ourselves in this predicament. Did we get that calculation wrong?
We didn't get it wrong. What happened was the situation changed. So the original calculation, the estimate was about 7%, 70%, and that's based on the COVID classic transmissibility, the wild type COVID, which infects, 2 to 3 people. The reproduction number is about 2 to 3 people in its unmitigated stage. Delta has changed that entirely because Delta is so heavily transmissible and it has reduced the vaccine efficacy by a little bit, such that the threshold for herd immunity now is likely above 85%, probably above 90%. So we got to try harder to get immunity penetrating into our society.
Well, and if it's not through mandatory vaccines, and it's certainly not working in terms of one-on-one because it's not, the uptick isn't happening fast enough. Is it limiting their rights to go about their normal lives with vaccination passports, etc.?
Yeah, I think that's what we have to do. Because there's nothing unethical about that. No one is denying anybody's services via vaccine passports. We're just saying if you want to have indoor dining or go to the gym or something, you've got to do an extra couple of things like get a test or wear double masking or something like that. So make it inconvenient such that over the course of several weeks, eventually you choose to get vaccinated. This is called nudge economics, and it works on a large playing field. It worked the anti-smoking campaign. You can't go dine indoors unless you smoke outside. After a time, people decided it's not worth smoking, so we give up smoking. We don't have a lot of time for this, though. We haven't got the years or decades that we had for smoking. We have weeks. So this plus some other measures have to be implemented to cajole people to accept vaccination.
I keep hearing the anti-smoking law as an example. Hey, it worked in long term. We basically forced them outside, so we didn't deny them the right to smoke. That being said, I was sitting inside the restaurant when my friend was smoking outside, and the secondhand smoke went away. But with COVID, it's not the same.
Yeah.
The guy's sitting across from me, and I may get COVID. We need to go a little harder. We can't be so patient as we were with the smokers.
Yeah, it's not a perfect analogy.
Yeah.
So this
the
is
seatbelt one doesn't work for me either. But that's the whole.
This is the price of living in a Western liberal democracy. We have to wrestle with individual freedoms as we try to push forth a public health agenda. It's tricky.
No jab, no job.
That's right. Yeah, that one's easy to me because no one's got a right to a particular job.
Right, and if you don't like it, you don't work here. But the problem is Ottawa right now, because we haven't got the full mandate policy yet. Apparently, they're working on it. In the meantime, it's up to the employers to decide. Meanwhile, you can't ask your staff their vaccination status. So you're damned if you do and you're damned if you don't, waiting for those in charge of public health to come out with a policy that'll cover everybody.
Absolutely right. For certain professions, forward-facing professions like teachers, healthcare workers, first responders, the government should step forward and say, these people, we can ask their vaccination status, and you are free to enact policies to compel them to be vaccinated if you so wish. I would love it if I could find a daycare with guaranteed full vaccination of its staff to send my little one to. But it's difficult. They're not allowed to ask their employees, right? So these are the kinds of things that would help people enormously. And the state has several policy levers they can pull to make things easier for business owners and citizens alike.
We pride ourselves in that democratic society that we live in to have free speech, but there are also limits to free speech. So I think there got to be limits to civil rights as well. And I'm not saying you can't go to the movies unless you're double vaccinated. If you want to actually participate in society, then you got to follow the rules. We don't send our kids back unless they're vaccinated for measles and mumps or whatever it is now. I don't understand why there's such a tolerance.
Yeah, it is odd.
For the ignorant.
Well, you said ignorant. I wouldn't call them ignorant. There's a certain loud minority that has a poor understanding of their risks and rewards and their role in society. And
you're giving them far too much credit. You are.
They're being weaponized by disinformation agents.
Thank you. They're repeating the propaganda and they're buying into it. Yeah. It's sad.
It is sad.
Hey, we need to go on tour. Coming soon to where we're going to go. We're going to make sure they're double vaccinated.
It's got to be a Zoom tour. It's got to be a social
Exactly. Exactly. You got the better hair, though. Dr. Ray, always good to talk to you. You're a wise man. Thank you, sir.
Thank you.
Dr. Raywat Deonandan, infectious disease specialist, of course, U of O's own science communicator.